Thank you very much, and I know you're surprised I started work here when I was only 10, but this really is a real special opportunity for me to have a chance to talk to you about the journey because I think we're really going to be talking about what I consider to be reality and how this program is going to apply here locally. Because I think it's important because, we hear there's a lot of talk and a lot of this is so new, it's conceptual, and what's critical is the translation to reality. And I think we have to understand the context because, this county is a $4.4 billion operation with 15,000 employees. We have 40 departments. We really are a multi-conglomerate. I mean, when you think about that, we operate a hospital. We operate an acute care mental health facility. We do substance abuse services. We're responsible for social services, child and family services, food stamps, eligibility for Medi-Cal. We operate a jail. We're responsible for probation, and both our jail is kind of growing into a prison based on realignment. We're having individuals that are no longer here for 60 days. They could be here now for 3, 4, or 5 years. We're responsible for prosecution and defense. We're responsible for land use decisions in unincorporated areas, environmental management. We assess your property. We collect your taxes. We manage billions of dollars, including the school's money, in our treasury. So the county's responsibilities are vast, and so it's really important, I think, that we understand that in terms of context as we move forward, because when Caroline talks about complexity, everything we do really is complex because the financing supporting all these things are really an important factor. The other thing I think is important, and the reason that I'm probably standing here, is because between 2002 and 2011, we had to close budget gaps of over $2 billion. And so that put tremendous strain on our ability to provide services. And so when this idea, social impact bonds, came forward, one of the things that when I first looked at it, I said, first of all, bonds, is somebody going to want the county to sell bonds? And so as I researched this, I realized that social impact bonds is really a term that I don't like because it's really not bonds. And so, the term that I've been using is social innovation financing or the pay for success concept. And so after some research and discussion, the thing that really I decided on was any opportunity to bring some new resources into the county to address the needs really was something that we had to have an open mind about. And in addition to that, of course, the work of the Health Trust, Catholic Charities, and Step Up Silicon Valley, plus one of our board members, Supervisor Cortese, who made a referral, it was clear that the community wanted us to take a very close look at this concept. And so we began working with third sector, some of the questions in my mind, because the key issue here in terms of how this works is, paying for success, so that the county has to find or generate the savings in order to pay back investors. That's obviously the traditional model. And so, I was a little nervous about that because I know that, for instance, there's a lot of our programs where the demand clearly outstrips the services we're providing. So that our emergency room in our hospital, you don't walk in and get service. You'll probably wait 2, 3, 4 hours. So if we reduce the number of people because, we have a successful program, that means the wait is going to now be an hour less. That doesn't mean I'm going to generate savings to pay anybody back. So my initial reaction to this was, oh, wait a minute, I'm not sure the county can really generate the savings. But at the same time, I think after some discussion, I think we were able to see that this was definitely worth exploration. And the experience and the insight that third sector brought, I think, was really helpful. So this first slide, and I want you to know that these slides, I've stolen them all from Third Sector. They're what I call PowerPoint prolific. They create more PowerPoint slides than anyone I've ever seen. So it was really easy for me to put this together. So this first slide really gives you a sense of the timeline that's occurred over the last roughly year. And I think what's important to recognize is the fact that this has been a very deliberate process. And what was built into this process were milestones that really allowed us to make a decision about whether we should continue this exploration, if there was enough value that we should continue. And on each of the steps, I think we found that it became increasingly clear to me that this could be a vehicle that could be very positive for our organization. And so what I'll do is just give you a brief summary of each of the phases. So we broke the project into basically 3 phases. The first phase was really sort of evaluating the landscape. And so Third Sector did a lot of legwork really determining whether or not Santa Clara County was going to be a fertile place for this concept. And so there was lots of discussion with county staff, lots of talk about, what areas might make sense. Lots of discussion in terms of the contract procurement process and whether or not, even at a very cursory view, that we could identify projects that could generate cashable savings. And so the initial map, as is described here, gives you an idea of the areas that we kind of were given as here is the sort of the library of opportunities. And it was created on this kind of graph, which sort of goes on the right, highest cashable, on the left is low, strong evidence-based intervention, provider and data, and low. So we had an idea of the areas that we might want to look at, more deeply. And so, okay. So then we moved to phase 2, which was really looking at these things in a more detailed way. And at the same time, we wanted to look at and talk to the providers, our community-based operators and funders, and begin to hear from them areas where they might have an interest or concerns in the case of providers. Because, one of the key things in terms of pay for success has been discussed previously, and I'm not going to go into it in great detail, is the opportunity to really focus on outcomes and not output. I mean, there isn't, I don't think, a government that really doesn't believe that that's the direction that we have to move. Certainly, the Board of Supervisors in this county increasingly is requiring those kinds of measurements so that their decision-making process can be based on real facts about whether or not outcomes are being met. And so, from my perspective as someone who is making recommendations on resource allocations, it's really helpful to have that kind of information and to create, that kind of objective decision-making process. Recognizing that there are other factors that enter into decisions, I understand that. But the basis in terms of, providing information regarding outcomes is really very important. And so phase 2 allowed us to further evaluate whether or not, any of these project areas that are identified on the map were going to be ones that were going to be, really going to, provide the potential success that we were looking for. And so, after phase 2, we really had a question in our minds: should we move forward or not? And again, based on discussions that I had with individuals that were related to the 2 areas that we eventually selected as our project areas, I made a recommendation to the board that we should move forward. And as you've heard, this whole effort really is the result of Health Trust's grant to Catholic Charities and Step Up Silicon Valley, and both Greg Kepferly and Almaz really have, been there all the way in terms of providing the support and momentum to move this forward. And it was at that point that we made the decision to recommend to the board that we actually begin investing county money. And so the board approved an allocation of $75,000. We were fortunate enough to have two new partners, the Sobrato Foundation and Silicon Valley Community Foundation, who are also investing $75,000 each. So now we have a $225,000 project budget for phase 3. Come on. Now, before I jump into phase 3, this particular slide gives you a little bit more information about the two projects that we've selected. And the one project that we really believe has potential cashable savings that fits more into the traditional model is in the area of acute mental health. And what we were looking at in our acute mental health facility, also known as Barbara Aarons Pavilion, so you may see the acronym BAP that's describing the Barbara Aarons Pavilion. We have patients that basically time out where we no longer are able to get a full reimbursement because they go on to administrative days because they're judged to be at a level of acuity that doesn't allow for the higher reimbursement. And we don't have the step-down facilities or providers available. So there's the potential for us to generate additional revenue if, in fact, we can move these people out into appropriate step-down facilities and at the same time bring other people in that are waiting and, again, increase revenue. So we saw that as a real opportunity. The bottom line was we then believed that we had that one cashable savings opportunity. The other approach that we had explained to the board was that we also wanted to look at a different path that was more outcome-oriented and perhaps would be less traditional in terms of the way in which a project could be structured. And again, this project would be more focused on outcomes. In this area that we were looking at was in the area of homelessness and the ability or the need to create additional affordable housing units and supportive housing services because homelessness in this county is a significant issue. We have over 7,000 homeless, according to the last count, over 2,500 chronic homeless people that have been on the street for many years. And I've actually, with Jennifer Loving, have been down in those encampments, and I've got to tell you, it's something that if you see it, you really want to do something about it. And so, we believe that this is an area that really has potential. And so these two project areas became the ones that we recommended to the board, and they approved pilot projects to move into phase 3. And once again, this is a little summary of those points. Again, trying to sort of separate them into two separate paths, cashable and high priority. And once again, additional information. I'm not, because obviously we're limited in time. I'm not going to go through all this stuff, but I put it in your packet so you could see a little more information, a little more detail. The other thing that I want to mention about on the homeless project is that prior to this project, the Pay for Success coming forward, the county had already initiated a voucher program because HUD and Section 8 vouchers, the funding had declined. The county stepped forward and the board allocated $1.3 million to try to enhance that program. And at the same time, we began a data study because, as is very important in this area, we really need to develop the kinds of information that will help us objectively evaluate how we're doing. And in the area of homeless, as you can imagine, the data is spread across many departments. And so we run into HIPAA confidentiality issues. And we worked with our county council, and I see Greta Hansen, who is here from county council, who was instrumental in developing a way in which we could collect data that is going to be extremely important in terms of measuring outcomes in terms of the way in which we're dealing with homeless issues. And that project, we're hoping, will be completed in the spring. But with that reality and knowing that we were making progress there is another reason why the homeless project was one that was very attractive to us. Now, fast forwarding to today, this is a slide that was provided to me a couple of days ago from Third Sector that provides an update in terms of the progress that we've made to date. And so in the case of mental health, after conversations with Nancy Pena, who you'll be hearing from later, and I don't want to get into too much detail here because she's going to get into a little more detail about the project, we've decided to actually create a second mental health project that kind of looks at the intake process in EPS, which is emergency psych service, which is equivalent to an emergency room for mental health. So people that come in that are decompensating go into our EPS area. And so the thought was the BAP project really was kind of focused on the back end. The EPS project would be focused on the front end to see if we could divert those people, if that was appropriate. So Third Sector is in the process right now of collecting data so that we're in the process of constructing a project and actually creating an RFP for the kinds of services that we think would be appropriate. And in both cases, we do think that there could be, or there will be cashable savings here. So once we determine the structure of the RFP and exactly what we're looking for, then we'll be in a position to move forward with a contract and be talking in more specifics to funders in terms of how that's going to work. In the homeless area, this is an area that I really am excited about because I do think that we have some potential here to take the vehicle of Pay for Success and really make an impact. And you know, my hope in terms of what I describe as a grand vision here is to try to even think in terms of creating a new model or a different model, a model that goes beyond Pay for Success but looks at ways in which we can increase the number of affordable housing units. Because as you can imagine and what you've read in terms of our local economy doing much better, rentals now are just crazy within Santa Clara County. Leslie Corsilia from the city of San Jose, I think you quoted 2,000 or 1,000, was it 2,000 for a studio? $2,000 for a studio. So, you know, Section 8 vouchers or county issued vouchers, you can imagine how difficult it is for us to find any landlord that's going to take that when the demand is so high. So one of the things I think the county has to think about, and one of the conversations that I'm going to be having with the county's ULIT committee, and of course both Supervisor Wasserman and Chavez sit on that committee, is really talking about what the county's role should be in terms of housing. And part of the intent here, part of my hope is that we can come up with a model that really brings partners together to help us add affordable housing and attach the Pay for Success concept on the supportive housing side so that we can have this increase in the number of units with the supportive services that keeps the people off the street and reduces the number of homeless in our community. This, again, is something that's still in process. It's obviously conceptual. But it's something that I'm pushing Caroline very hard in terms of using her team's high level of intellect to help me figure out how to do this. So, and certainly the rest of you that also have that high level of intellect, you know, if you have good ideas, I'll leave my email and please forward your ideas because this is a problem that we really need to deal with and we really need to solve. I think the potential and the opportunity the Pay for Success offers us. I think it offers us the opportunity to think outside the box, and I'll use that tired cliche, but the reality is that in a community that has so many positive things going for it, 7,000 homeless, living along on the streets or in encampments just is not acceptable. So with that, am I asking for questions, or the question's going to be later? Okay. If anyone has a question, I'd be happy to. Yes.
So with county agencies, how did y'all overcome, or did you, some of the issues that you mentioned about sharing information, client confidentiality, say for mental health,
Yeah.
criminal justice, the different
Well, the details of that, I'm not sure that I can explain, but Greta's here from County Council, and I'm sure that she can talk to you afterwards, because it was one of those things where I actually wasn't involved in the sausage being made there. But the key thing is that we found a solution for it, and one that is working. So we have actually collected the data, and now we have it with our consultant, the Economic Roundtable out of Los Angeles, and they're actually putting the information together. But it is a laborious process, and obviously names have to be removed and all that. But the bottom line is that the quality of the data that we have, that is really going to be the basis upon which we're going to be able to really measure how we're doing, has just been improved dramatically. Anything else? Okay, thank you.